Good morning, everyone. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be doing really good. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in our lives. Now, urticaria is characterized by a round rash on the skin that itch a lot. It may be due to chemicals in certain food items, allergy to certain medications, insect sting, sunlight, and sometimes the cause is even unknown. So, as per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Now, urticaria is classified as acute and chronic, but the most important part is not to ignore it. And doing self medication can worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, and the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist Dr. B. Soorya, who is an MBBS, MD, medical and aesthetic dermatologist, and she has many years of experience in this field. A very warm welcome to you, Dr. Soorya.
Thank you so much. It's very nice to be here.
It's a pleasure to have you, Doctor, with us. And urticaria being so common, it's important that we talk about it because many of us are not aware about it. So, Doctor, to start with, what is urticaria?
As you said, urticaria is also known as hives. It presents with itchy, raised, reddish or pale colored swelling on the skin that appears suddenly, and it can last for a few hours to few days. It actually occurs due to histamine release from the mast cells and other inflammatory mediators. It's the lesion, which is red color, raised, and it can be also pale, appear on your all over the body. It can appear anywhere, and it's usually transient nature. It actually disappears. Individual lesion disappears within 24 hours, but new lesion can continue to appear on other areas. And it's, as you said, it's very itchy, and it actually make the patient very uncomfortable. So it's better to know about urticaria.
Absolutely, and that's what we are looking for forward in today's session. Now, Doctor, what causes urticaria? What are the main causes for urticaria?
There are a lot of causes. Each and everything surrounding us can cause urticaria, but the commonest I'll just say you allergic cause. Allergic can be due to insect bite, due to food like egg, nuts, fish, the colored items which is mixed on the food, and even drugs like painkillers, opioids, contrast dyes which are used for your radiological examination, all can cause allergic type of urticaria. The non-allergic triggers include infection, physical stimuli like cold, exposure to cold or sunlight, or if you have increase in your body temperature, that's called cholinergic urticaria, or if someone is holding you tight, that is called pressure urticaria, and vibratory sensation can cause vibratory urticaria. And even emotional stress is one of the main triggers for urticaria. And there is a idiopathic, which the cause is unknown. It's mainly due to autoimmune reaction. These are the commonest causes of urticaria.
Okay, so anything under the sun and even sun can cause urticaria. So the causes are many. Now, Doctor, is it a kind of allergy?
Yeah, if it is due to allergic trigger, it is allergic reaction. It is a type of allergic reaction, but it can occur due to allergic or non-allergic cause.
Okay. Doctor, as you have said that in urticaria, rashes appears and then there is itch, a lot of itching is there. But as a layman, we know that most of these skin-related infections, allergies, they appear as rashes, they itch a lot. So to be more specific as a layman, how do I understand that what is affecting my skin is urticaria? Can you tell us how does it look like for more and better understanding?
Yeah, absolutely. For layman, you have to see the individual lesion will appear suddenly. It will appear as reddish or pale color, raised itchy lesion on your skin, and it actually disappears within few hours. That is the main point where you can differentiate from other disease. New lesion may continue to appear, but when you mark an individual lesion, it will disappear. Or if you have doubt, if you scratch your skin with your hands or with your nails, that new lesion will start to appear on your scratched site. That is called dermographism, which is one of the main signs for where you can identify urticaria by a layman.
Doctor, is urticaria a serious condition? I mean, okay, it itch a lot. It do affects our, or hampers our quality of life. But is it a serious condition as well?
Normally, urticaria resolves on its own, but if the urticaria affect deeper layer of skin, like your mucous membrane, there will be swelling around your mouth, around your eyes, hands, and feet. That is deep form of urticaria, which is called angioedema. The more severe form is anaphylaxis, which is a allergic reaction, total allergic reaction where you have breathing difficulty, you can have unconsciousness, your airway, breathing, circulation will be affected. So, if you have anaphylaxis, immediately run to your doctor.
Okay. So, in that case, you need to go and immediately seek help from a doctor. That is really important. Now, doctor, talking about the bifurcation or types of urticaria, as I mentioned before as well during the interaction, that there are broadly two kinds of urticaria, acute and chronic. Would you like to shed some more light on that?
Yeah, acute urticaria when you have the disease which resolves within 6 weeks, that lasts within only for 6 weeks. That is called acute urticaria, and it appears suddenly. It is mostly due to allergic causes. For chronic urticaria, if the disease persists more than 6 weeks, it is called as chronic urticaria. It's usually due to unknown cause, that is idiopathic, or due to autoimmune disease or underlying any disorder associated with it. So you have chronic urticaria.
Okay, so there is this acute and chronic thing. When a person comes to you, are there any tests that you normally recommend for knowing exactly the root cause, etc., or just by physical investigation, you're sure that yeah, this is urticaria and this is acute and this is a chronic?
Actually, 99% we can identify with physical examination, depending upon the characteristic lesions, size, shape, duration, whether it's associated with angioedema or anaphylaxis. If the underlying cause is suspected, we go for laboratory examination.
Okay, and what kind of laboratory tests are there then?
Actually, it depends upon the cause. Normally, for ruling out, we'll start with complete blood count, ESR. For allergies, we'll do IgE levels, absolute eosinophil count. Your urine and stool examination will also be done to rule out infections. And if you have underlying disease like thyroid levels will be taken. If you have an autoimmune disorder, autoimmune profile will be done. These are the commonest tests we'll do.
Mhm. What happens many a times, because people are so aware these days, we have these allergy tests. They are not that pocket friendly, but still people fall for that. And without even consulting their doctor, they'll directly go to the lab, get the allergy test done, and then with the reports approach the doctor that, see, I'm allergic to these 50 food items. On practical basis, eliminating 50 food items from your, thali or your routine life is not a very practical thing to do.
Exactly.
So, what is your advice on that? Do we need to get these, allergy tests, etc., before approaching a doctor?
Absolutely no. Don't waste your money. That's what I'll say. Because your doctor can treat the disease without your allergic tests. Why to waste your money? If you wanted to get done, if your doctor is able to identify the cause, treat it well and good. If he is not able to identify it after all routine things, then try it out. Don't do it before consulting your dermatologist.
Okay. Now, a very common question that people who specifically have chronic urticaria, they ask that how will they completely, get rid of these lesions, or will it permanently go away, etc., etc. Because for them, the medication is for a longer duration.
Exactly.
What's your take on that?
Actually, yeah, it's true. They have to take medication for a longer amount of time. But we can control the disease even with first examination itself. we can control it. We cannot cure it because it's chronic. When we can identify the underlying cause, we can treat it and cure it. But usually, urticaria resolves on its own. The remission rate is almost 80% within first year. Within 1 to 3 years, it's almost within 3 years, it's more than that. So, no need to worry. The medicines will never have a side effect if you are consulting a dermatologist and taking it. So, be patient. It will go. Don't worry.
Doctor, are there any potential complications of urticaria if left untreated?
No, if you have a severe form like angioedema and anaphylaxis, that can be a problem.
Hmm.
Other than that, the patient can feel itchy and they will be disturbed. Other than that, no major complication will occur with that area.
Hmm. But that itch, because it keeps you engaged most of the time, it's quite
Exactly.
embarrassing even at your workplace or at public places. It's quite embarrassing. So, in case you have urticaria, please go and consult the doctor so that you can get early relief. Another, a very common tendency, doctor, in our society is to go for over-the-counter medication, over-the-counter topical application, home remedies. We are so obsessed with home remedies, DIYs, do it yourself. These days there are so many influencers on various social media platforms, and not all of them are dermatologists, but then they love talking about skin care or telling us skin remedies. So, what's your take on these home remedies, DIYs, over-the-counter topical applications, or taking allergy pills all by themselves? Do they really work?
Actually, when you take OTC medicine, they give you antihistamines or steroid. When you take the drug for 1 day, it will keep the urticaria away for 3 days. But it won't cure or you won't have relief for longer time. So, and there may be side effect for steroid drugs if they prescribe you or if you have associated condition like diabetes. So it's better to consult a dermatologist. I don't think so any DIY or home remedies are available for urticaria as of now, but
Hmm.
OTC is the most commonest form. Even before coming to us, patient will say, I've taken an antihistamine like levocetirizine, cetirizine from over the counter from the pharmacist. But it can relieve your symptom, but it cannot cure your disease. So please do consult your dermatologist.
Now, what people do, many of times they'll apply something on their lesions. They'll apply either aloe vera gel directly from the plant, is very common, or some kind of oil, be it coconut oil or turmeric, curd, or something on their lesions to get that calming effect. Do they work, or they can be harmful as well?
Actually, it just calms your skin. It's like a moisturizer. It doesn't do anything much. So your lesion actually disappear within few hours if you do or do not do anything. So it's better to avoid these things. You can apply a moisturizer if you have irritation. Other than that, please don't use turmeric or something else.
Mhm. And as you said in the beginning, that anything can, trigger urticaria. So in that case, if, for example, if I'm allergic to turmeric, I may don't know it, but then after applying turmeric, it will, yeah, even make it worse. So let's not experiment with our skin. The easiest way to go and approach a qualified dermatologist and get the treatment started. What are the treatment options available, doctor?
Actually, urticaria, the first main general measure is identify and avoid the triggers. That itself is majorly important. Then you have antihistamines. That is, it can be sedative or non-sedative. We normally give non-sedative antihistamine in the morning and sedative at the night, and we can increase the dose up to 4 times depending on the response of patient. The other drugs which are available are oral steroids, you have immunosuppressant, and you have autoimmune drugs, even biologicals, that is the last mode of treatment. So these are the available option. Depending upon your cause, severity, and duration, we tend to mix all these drugs and give you.
Right. Now, many times people complain that their vertical lesions become worse or more, tiresome during night. So, does it happen, doctor? What is the correlation?
Actually, normally any itchy lesion will increase at night because morning you are occupied, you don't notice it with your work. But at night, when we are calm, the lesions will start, the itching will be more. But the lesion can appear any time of the day. It doesn't match with the time, but itching normally it is more at night.
Okay, so you're more preoccupied during the day with your
Yeah,
work, etc.
exactly.
But during night, of course, it worries you the more. Can urticaria be caused by stress, doctor? And if yes, then how does it look like? And we know that we often say that stress is bad for overall health. So if one is suffering from urticaria, of course, that is increasing the stress level of that patient. So that stress is going to even make the urticaria worse.
Yeah, exactly. Emotional stress is one of the main triggers for urticaria, but you have to take care of your stress. That is the main form of treatment. We can give antihistamine, but if you are stressed, it will continue to appear again and again. So, meditate, exercise, keep your mental health peaceful, and follow a balanced diet and stay hydrated.
Okay, so taking good care of your health is very important, and also taking the right treatment by going to the right person, which is a qualified dermat, is equally important. Don't waste your time on DIYs, home remedies, OTC products, etc. Go to a qualified dermat and continue your treatment as long as you have been advised for. Another very common tendency, again, doctor, is that, for example, I'm your patient for chronic urticaria. You advise me or prescribe me a medication of, say, 2 months. I'll religiously follow it for 15 or 20 days. And then, because I'm getting relief, or I'll feel that, okay, now I'm fine, no more lesions, nothing. So I'll stop the medication all by myself. Again, in case I see the signs or symptoms, because I have the prescription, I'll go take the medicine and start it all over again. This is a very common practice, and I'm sure you also get patients like that.
Yes,
So,
right.
what's your advice on that? Is it okay to do practice, or we need to continue the prescribed medication?
As you said, absolutely within actually 1 week to 2 weeks, the lesion will heal completely and you'll be relieved of itching and every other symptom. So patient tend to think that it's fine. But if it's acute urticaria, it's fine to take medicine for 20 days and leave and see. But when it's chronic, it's better to continue a drug. We don't give the same dosage every time. We'll taper it slowly. So don't worry, there won't be any side effect. Please do continue that. Because if you discontinue it, you have to start from first the next time you visit your dermatologist. So it's better to lower a drug slowly and taper it slowly and consult your dermatologist and continue with them. Please don't stop your medication if it's a chronic urticaria.
Fair enough. Now, doctor, there is a viewer, Tina Bhargav, and her question is that do heat or higher temperature also becomes a trigger for urticaria? And we have seen many a times, pressure or very cold weather, very hot weather, or immersing our hands or feet inside the water for a longer time. They also kind of give urticaria. So would you like to let some light on these
Yeah, it's
category?
called physical urticaria, where a physical certain stimuli can trigger your urticaria. As she asked, it can trigger urticaria, and it does for many people. So avoidance of the trigger is the main factor. You can try to avoid it as much as you can. You cannot avoid it completely because body temperature and the environmental changes cannot be controlled. But do have an antihistamine with you if you first consult a dermatologist and confirm that it's urticaria due to that specific physical stimuli. If it is, then they'll prescribe a drug. Then you will have to taper the drug slowly and have the drug with you when you go for vacation or when you're going out. So if you, because of that physical stimuli, if you are getting urticaria, that will help you with that. And as you said, there are a lot of physical stimuli that can cause urticaria, like cold exposure, cold water, cold air, hot, increased in hot temperature, that is called cholinergic urticaria, even sun exposure, that is called solar urticaria, pressure urticaria, when someone hold you tightly or when you put pressure on your body, then that can cause pressure urticaria. Even vibratory sensation can cause urticaria. So it's better to identify your trigger, and avoiding it is the mainstay of treatment for physical urticarias.
Right. So avoiding your trigger is the main step forward. Another similar question by Disu is: can hot showers worsen urticaria symptoms?
If it is due to physical stimuli like increase in body temperature, or then it can worsen it. Other than that, that a hot shower can strip the moisture, so you can feel more itchy along with urticaria. So when you have active lesion, please do avoid hot shower.
Right. Now, we are getting few questions regarding the skin color. Like Anuj Kumar is asking, can urticaria cause permanent skin damage? And another similar question is by Tanishka, does urticaria cause any changes in skin color? So about
No,
skin texture and skin color.
no, it doesn't. It doesn't. Each lesion will disappear within 24 hours. So you no need to worry. But if you are scratching your skin because it's itchy, and if you're making any wound, that can cause post-inflammatory hyper or hypopigmentation. That will also heal in 1 or 2 months. It doesn't give any color or textural changes to your skin. Articaria doesn't do that.
Okay. Um, Now, Lucky Sharma is asking, does urticaria affect fertility as my wife is pregnant?
No, it doesn't. It doesn't affect your fertility. It is just a reaction from your skin due to the stimuli. It can be allergic, non-allergic, due to infection. Treat underlying disease. If she is pregnant, please do consult a dermatologist, because there are certain drugs which should not be given during pregnancy. So consult a dermatologist and take accordingly.
Right. So we all know that during pregnancy we need to, take care of the medication as well. So over-the-counter medication is a big no-no. So if your wife is suffering from urticaria, please go and consult a qualified dermat rather than wasting your time and risking her health over other things. Now, Kiara Chauhan is here, doctor, and her question is: can viral infection trigger urticaria?
Yeah, it does. Infection is one of the cause. It can be viral, bacterial, or it can be fungal. When you treat the underlying cause along with antihistamine, your urticaria will completely cure.
So, when a patient comes to you, when you were telling us initially that many a times you go for, full blood analysis reports, etc. So, this is also one of the reasons why you get the blood samples tested so
Yeah.
that you know if there is any underlying medical condition. Okay, and we have seen a lot of cases of urticaria even during the time of COVID. So, after COVID, many patients complained of hives, etc.
Because that doesn't correlate with your vaccination or COVID medication.
Yeah, yeah,
It
yeah.
can be because you are experimenting new cooking things or adding many color substance that can trigger your, because you're not exposed to outside world. So physical
Right.
stimuli will be very rare for you to cause. But COVID
Mhm.
vaccine, it's very, very rare. Every vaccine can lead to urticarial reaction, but it's very, very, very rare. You get immediate reaction after COVID vaccines or COVID drugs. So that's because of COVID. That doesn't correlate with urticaria. It's just people notice more.
Right. Now, doctor, as a doctor, do you give or tell us any do's and don'ts when it comes to our diet? Anything that we need to avoid as a patient of urticaria?
Normally, I give a food list which are triggers for urticaria. The patient doesn't identify the trigger, so I'll give a list like eggs, nuts, colored items like cool drinks, bakery items, and certain vegetables like tomato, lemon can trigger urticaria, mushrooms. So it's better to avoid during the course of your treatment and then reintroduce it slowly, so you can identify the trigger if you are suspecting food as your cause trigger for your urticaria.
Many times when people go out to eat, especially from these fast food vendors, etc., they complain of urticaria even if it's acute and it goes away in few days. So is it the food color or preservatives, etc., are they big causes of urticaria?
Yeah, it does. It is a big cause for urticaria because of different sauces, the colored items which they add for your things. So it's better if you had an episode of urticaria, or if you have an episode, please do avoid these things.
Okay. The doctor, when a patient comes to you, and maybe I was not allergic to egg throughout my life, then suddenly I have noticed that, whenever I eat egg, I get these lesions. Do you normally ask your patient to keep a diary or make notes or something whenever they get the lesion? Because finding it, even for the patient, it becomes very difficult because we do like so many things in a day, and as you said, anything and everything can cause urticaria. So it becomes so difficult as a patient also to tell a doctor that what we have done. And if I go to a doctor after 10-15 days, I won't remember what I did 10-15 days ago. So, is there a way to note down or something like that?
I ask my patient to write down and show me what they ate 3 days before the lesion. So if I can identify the trigger, it's patient is the only person who can identify the trigger because doctor can ask question. The patient
Right.
should know. Okay, today I am getting urticaria. So what all I did? If you think something is abnormal, please note it down on your phone or in your diary. So you can ask as a doubt to the doctor next time and clarify whether that is a trigger or not. So it's better, as you said, it's well and good to maintain the diary. But if they can't, if they suspect something, please do write and keep.
Okay. The Deepak is here, and his question is: can urticaria affect the lips?
Yeah, it does. That is called as angioedema, a severe form of urticaria, where the lesions are deeper when it affects your mucous membrane. If it affect your mouth and eyes, or if you have breathing difficulty, that is a severe form of urticaria, which is angioedema. Do inform your doctor so they can taper the duct accordingly.
Okay. Many a times, patients of urticaria complain about getting tired or fatigued. So, is it also a characteristic, doctor?
Not characteristic. Some patients do get tired. It depends upon the individual, but there is no direct correlation between urticaria and tiredness. But some people do feel tired because of the overall itching, lesions, the increase in temperature. All can make them tired.
And antihistamine drugs, or what we commonly as laymen call anti-allergens, they also make us little, fatigued. So, is it also due to the medication? Medication could be one reason.
Yeah, it can be. Actually, there are two type of antihistamines: sedative, non-sedative. Sedative, you will feel more sleepy. So if you are
Hmm.
taking at night and if you have a good sleep, that's well and good. But your sleep is disturbed, and if you are getting up early, you will feel tired. Morning, we usually normally give non-sedative, so you won't have problem with that.
Okay, right. Is urticaria contagious, doctor?
No, it is not at all contagious.
Okay, because normally people feel anything to do with your skin, if it's an allergy or infection, others will get that just by shaking hands or something.
Yeah, exactly. This is a reaction of your skin, so it doesn't spread. Don't worry about it.
Okay. Now, Suhana Thakur is here, and her question is: do hives go away after a few hours?
Yeah, it does. It is actually transient in nature. Individual lesion usually disappear within 24 hours. But new lesion, if your disease is active, new lesion may continue to appear at other site. But the same site for 1 day, 24 hours, new lesions will never occur. So it's transient in nature. It will go away with or without treatment. But if you are not in treatment, new lesions may continue to appear.
Okay. The doctor, Kirti Kapoor is here, and her question is: can taking vitamin help urticarial prevention?
No, it doesn't. If you have a deficiency, do take it, but that doesn't correlate with your urticaria.
Okay. Faria Beg is here. Her question is: can I use cold packs for urticaria?
Yeah, if your trigger is not the physical stimuli of cold doesn't increase your urticaria, well and good, you can use because urticaria increase your body temperature and you will feel hot. So using cold pad can be beneficial for you.
many times what happens, for example, I'm suffering from acute urticaria, I got the trigger and it's very itchy, annoying at the same time, but I'm not being able to go and consult a doctor immediately for whatever reasons. Now if I have to survive with that itching for 2 days or 1 day, is there anything normally that you recommend that is safe and we can use it to just calm down and have a soothing effect on those lesions?
If you already been having urticaria, then have an antihistamine with you. If you are not able to consult a doctor, do take one. That will help to control your lesion. There are many topical antihistamines available in the market, like Zyzal UC gel, Calamine lotion, Atarax lotion. You can apply it over your skin so it can soothe the lesion for 1 or 2 days. Then you can consult your dermatologist.
Sakshi is here and her question is, can applying aloe vera help urticaria?
See, aloe vera is a moisturizer, so it does calm your skin, but it doesn't cure the urticaria, but it can calm the lesion for the time being.
So aloe vera can be used for a shorter period of time.
Yeah,
People
exactly.
also apply calamine lotions for that soothing effect. Can it be used?
Yeah. For soothing, it can be used. Topical doesn't do anything. Don't use food items for topical application. Aloe vera, moisturizer, calamine are well and good.
Mhm. Normally, how much time the medication goes for? I mean, what is the duration of the medication?
Normally, we for acute urticaria, we give for a month, 20 days to a month, and taper it slowly depending on the response. If the patient gets cured once, we'll stop the medication. If not, we'll taper it slowly. For chronic urticaria, you have to continue it for 6 months or more, depending upon your severity, cause, and duration of your disease.
Mhm. Is urticaria anything to do with your family history, genetic, etc.? Do they play any role?
If the underlying cause is suspected, if it has genetic predisposition, then it can have for 0.5 to 1%. Other than that, urticaria is not genetic.
Okay. Doctor, before we wrap up, anything that you would like to tell us before we conclude the whole session? Any take home message for our viewers?
Yeah, you have for identification of urticaria, and you have to know few points. Urticaria, it appears suddenly, so don't be afraid. Immediately consult your dermatologist. If you are not able to consult, as we have said, identify the trigger and avoid it. That is the main form. And identify the lesion, whether it's urticaria or not. It will appear suddenly. You'll have reddish raised lesions, which is itchy on the skin, which disappear with 24 hours of time. So identify the lesion, and if be sure if you are be aware if you are having angioedema or anaphylaxis, and immediately contact your nearby doctor so you can treat with that. Avoiding the trigger and knowing the characteristic lesion is the main form.
Right. So avoiding the trigger is the main thing. And for that, you please go and consult a doctor. Also maintain a diary or make a note of whatever you have done before 2, 3 days so that you can very well explain the doctor and your doctor can understand it in a better way. Thank you so very much, Dr. B. Surya. It was wonderful it was a very wonderful session. Thank you for your valuable time in making this session so informative. At least now we know, that what is urticaria, what are the various reasons or causes for urticaria, how to prevent it, how to go for it, how to get it treated, etc. So now at least we know the right management approach for urticaria. Thank you so very much for making us all so aware about urticaria.
Thank you for having me here. I thoroughly enjoyed the session. Thank you so much.
Likewise, Doctor, we had a wonderful time, and I'm sure our viewers now understand, that doing self-medication is a big no-no if you have urticaria, no matter even if it's chronic, because, people get really annoyed and frustrated because the treatment duration is also longer. But at least when you go to the right person, which is a qualified dermat, at least you know the way. The doctor will tell you, guide you, and help you in the proper management of urticaria. At least you'll get relief of those, itching, etc. So you can work well, you can enjoy your social life, etc. So that's going to definitely increase or maintain the good quality of your life. Thank you so very much, Dr. Surya, once again.
Thank you. Thanks so much.
And viewers, thank you for your excellent participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. And we are also available on YouTube, Twitter, and Instagram. So stay with us, and we'll keep on bringing many more topics like this and discuss it with the experts and tell you how to take care of your skin. Thank you and have a wonderful day ahead. Goodbye.